these are working. Huh?
They were showing surgical instruments one time when we went going, and it was
Where's this? Flea market?
at Dorsey's Flea Market.
Oh my gosh, I got my nephew. I got my nephew this infinite cowboy sign, like neon sign, and then then my brother got another like Bell's cowboy store, and then for my husband I got a dolphin like neon sign. Yeah, really nice. Yeah. So there's a new. So I have a Filipino guy. No, he's Thai. Willis, that's why he's looking at my plant stuff, and he propagates all his plants. And he has a little,
One upper half.
he has a little princess, but now there's some other dudes. Dude, they had magnolia trees for $35. Really? Yeah.
Cheap.
I'm like, yeah. This like a magnolia tree, even like a 4-footer, is like $200, $250.
Hello.
$35.
We're just coming back after taking a break to put this patient over. Dr. J is currently in surgery. As you can see there, Dr. J is making some markings for this patient's tummy tuck.
$250 a palm tree. They have palm trees for $30.
Yeah, we bought these for like 150 each.
Well,
And they died the next
Hey Leah, I want to see before and after photos with surgeries. Yeah. Do you follow us on any other social media? Like our TikTok, our Instagram? Do you follow us there?
Even if you call the landscaper, tell them to go around there.
No palm trees.
Hey, thanks for joining us
So here's my question.
on our Instagram. Yeah, Leah.
On my fence line, the trees are growing into my yard.
You have to pay for it.
Does?
I have to send you a certified letter. With your plan.
Our social media platforms on our TikTok and our Instagram, they're going to be under the name of Dr. Boom Boom Pow.
I would just go tell them, hey man, they're coming
And
on my
there
side.
you'll see a lot of
I'm not an arborist.
You'll see a lot of before and afters of patient surgery.
But I know my skin, I will come down, and that's what I did yesterday.
So that is
Yep. So like with our neighbors, the tree on our side that go into his, I cut and I but I broke them so that when the branches fall, they
Yes, Dr. Boom Boom Pow.
He has a nasty ass hip-hop tree. He's never had an arborist come and prune it or nothing. And my husband ended up sending him a certified letter. And now we're gonna sue him because he never paid his half of the fence. And now he installed some solar lights, and my husband was like, oh hell no. He didn't even pay a dime into that fence, and I want to put this shit on my fence? No.
And so Dr. J is now working on this patient's tummy tuck. Earlier we did some liposuction on the patient's backside. We took a little bit of a break, a brief
Do you have any
break.
trees on your property?
most of the trees next door.
Okay.
They're like, you gotta do all that.
Could you get back the at-home ninja obstacle course and the little safety net? They have those like, remember on a ratchet strap kind of thing, like a tightrope? Yeah, it has all those obstacle, like the ladders, like the hook bars, and all that stuff. The bridge, like they have one of the bridge.
Yeah, Leah, how much is a mommy makeover? So that is definitely going to vary based off of everything that you're having done. So if you're getting a lot of different procedures done, like your breast, your tummy, your butt, lipo 360, it's going to be more expensive depending on the work that Dr. J would have to do. You can expect over
He gave 12 minutes, 36 seconds.
over 20 grand, but again, that price is going to vary. For more accurate pricing information, we can provide you with a free estimate by you giving us a call or going to our social media, filling out our leads form. That way we can get in contact with you. Hey, Tom Schneider, how much or how old is the woman? So this patient is is about in her mid-40s, about that Dr. J is with currently. Again, she came in to see Dr. J for a tummy tuck, some lipo 360.
Yes, please.
Leah, great question. What is the BMI requirements? So this one isn't really subject to change. It's pretty much Dr. J can make some exceptions if your BMI is a little higher than what's recommended, but it's not very often. Generally, a BMI of 35 and lower is what's recommended. And then certain exceptions can be made for you if your BMI is like higher than 35. But that can all be squared away during a consultation. Dr. J would probably will most definitely go through your medical records, your medical history, basically assess based off of your history and what you want to have done, whether or not it would be safe to make that exception. And so that's how we would be able to determine whether or not you are eligible for surgery like that. And as you can see there on our YouTube, Dr. J is getting started on this patient's tummy tuck. Always starts by making that very long incision from one hip to the other on the lower abdomen. We will be live for this patient's surgery for a little while longer. Just showing you guys what's happening here in the OR with Dr. J, and then we will get off here shortly. Again, we were live earlier this morning, showed some liposuction that Dr. J was doing for this lovely patient. Then we took a brief break, flipped her over, and Dr. J did some more liposuction and the tummy tuck.
My grandmother, yeah, he had a hospice there, but she did it overhead.
Hey Leah, do you guys have aftercare for out-of-state care if someone is by themselves? That's a great question, Leah. So during your recovery process for after surgery, you are going to need somebody to basically care for you in the ways that you would usually care for yourself. But unfortunately, you're not going to be able to do a lot of the things that you're used to doing right out of surgery. You're going to, depending on what you have done, you are going to want to limit your mobility extremely. So we do offer overnights here after your surgery. We offer overnights for patients who would like to book an overnight here after their surgery. We do help help people make arrangements to get out here to have their surgery if they're out of state. But you can always look into hiring somebody to take care of you during your recovery if you don't have anybody at all. And in order to really determine like what would be the best course of action, we'd have to sit down with you, have that consultation, talk to you over the phone. So let me know if that's something you're interested in. Is the woman under general anesthesia? Yes. So she is completely asleep. As you can see there, like Dr. Jeneby is working on this patient's stomach. So a very invasive procedure. They could not do this while the patient is awake. It's just, it would be very uncomfortable for the patient. It's just not recommended. The only thing that Dr. J really does for patients that decide not to go under general anesthesia would be some lipo. You can do lipo awake, or some other procedures, like if you are getting an explant, so like breast implants removed or something like that, that's not super duper invasive. That can be done awake, but more than not, it's not recommended that you ever stay awake during any other procedure. How much? Do you refer a special people that do recovery as well? I'm not really sure what that question means. There, Leah. Do you refer a special people that do recovery as well? No. I'm not really sure what that question means. So Tom, we're not going to do that just to protect this patient's privacy. We only show the patient's procedure. We never show the patient's face, obviously, because that would be, obviously they didn't consent to that. They just wanted to show people the procedure that they're having done. Oh, okay, Leah, I gotcha. Alright, so like I mentioned, here at one of our surgery centers, Maximus, we offer overnights. So we can set you up with an overnight here. However, in order to like inquire further about recovery homes and whatnot, we would have to get you in contact with our team, because I'm not really too sure on that, whether or not we are in network with recovery homes. But like I mentioned, you can always hire a care provider during that time to take care of you during the week to 2 weeks after surgery, to help you with your drains and everything. Because again, there's a lot of things that you can't do after surgery that you're used to doing on the daily. So again, we'd love to set up a consultation with you. From there, we can answer more private questions like that in more detail and specific to you. Can you be on your period during a breast augmentation surgery? Christian faith, that is a great question. Yes, you can. Being in the medical field, and these nurses or surgeons, they're very skilled at when it comes to handling natural human, I guess you could say, reactions. So they've had a lot of experience with handling people that, you know, may use the restroom during surgery, or you know, it's a natural process. You can't prevent like your period from happening, so we just work around it. During that time, they will provide like certain tissues, certain things that will not interfere with the surgery. That will make it more comfortable for you, make it easier on our surgeons, make it easier on their team as a whole. So yes, you can be on your period during a breast augmentation. We see a lot of patients that are on their period, and there are things provided for them so that they're not just like bleeding out on the table, if that makes sense. So I totally understand your concern. Sometimes patients will use the bathroom, like go number 2, or it's just something you can't stop. You can't prevent that. And so what you can do is work around it. And so our team is very experienced in handling situations like that. I have my surgery Thursday and I'm embarrassed I'm on it. No, it's okay. I understand completely. That was something that I had questions about. I didn't think about at first. But again, it's very normal. It's a natural process, human process. So you're good, girl. You'll be fine. They will ensure that you are taken care of. But yay, that's so exciting. What procedures? Just the breast augmentation. Forgot you mentioned that. What do you recommend for the blow after surgery? That's a great question, Christian Faith. So basically, you're going to have some swelling. If you're talking about bloating from the surgery itself, that will go away during recovery. So and since you're on your period, I don't know how that's going to affect the bloat, if you will, but the swelling will go down a few weeks after surgery significantly from when you first noticed the swelling. Obviously, like if you make that incision and you put a foreign object into your body, it's going to react to it, and so because of that, we can't really stop the swelling. Unfortunately, there's some things, like if you just make sure that you are taking care of yourself, you have a caregiver that's looking after you, and you're taking it easy, you're doing basically everything that the nurses walked you through for post-care or post-op recovery, then you should be fine. Naturally, you'll see the swelling go down, but you can't completely avoid it, is what I'm trying to say. Let me know if you have any more questions. Miss Christian Faith, they're all valid. I totally understand. I feel you on a lot of levels right there. But we'll be live for a little while longer for Dr. J. Gonna run across the street and see what's happening over there at Chrysalis with Dr. Phillips here in a moment. But be live for just a little while longer. Let me know if you would like to get in contact with our team. For those of you who are interested in plastic surgery and getting an estimate of your desired procedures, I went ahead and pinned a form right here on the bottom of your screen for those of y'all that are interested in getting in contact with our team, getting a quote. So that would be like a quote for procedures that you're interested in. And from there, that form will basically get you in contact with our team because it has all your information on it. And so our team will basically give you a call, an email, a text, you name it. And from there, we're able to move forward, figure out financing, figure out what surgeries you can have, get your virtual and in-person consultation, all of those things. As you can see there, Dr. J has removed the first side of fat that this patient had marked off for removal for the tummy tuck. We're showing that on YouTube. Again, we're gonna get off here shortly, but just thought I'd shout that out really quick. But yeah, be live for just a little while longer, and then we're gonna get off and go across the street. So let me know if you guys have any more questions before we do so. Again, hope y'all are having an amazing day. It's a pretty lovely day. This morning it wasn't scoldingly hot. It was a nice breeze. Finally, autumn is kicking in. So excited. It's my favorite time of the year. Again, this patient that Dr. J's in surgery with came in for a tummy tuck and lipo 360. Earlier we did some lipo 360, and now this patient, Dr. J's on the tummy tuck portion of this patient's procedure. So Dr. J already basically surgically removed, cut off the first side of fat and skin on this patient's stomach. He's now cutting off the second portion, as you can see there. Wow, you see that is a lot. Her results are going to look amazing. Where does Dr. Phillips do surgery? I'm booked with him for October. So excited and nervous. Yay, Miss Diana, that's so exciting. So happy that you decided to book your surgery. Where does Dr. Phillips do surgery? So if you are booked with Dr. Phillips, I hope that they've sent you all that information. Dr. Phillips operates here at Maximus Surgery Center and Chrysalis Cosmetic Surgery Center. So let me know if that rings a bell at all. You said you're booked for surgery? Dr. Phillips operates here. His team should have let you know where he'll be operating, where your surgery should be. Let me know if that's the case, if they let you know. Yes, I have my 2-week appointment on October 8th. I gotcha. Yeah, so Dr. Phillips will operate either here at Maximus Surgery, Plastic Surgery Center, or Chrysalis Cosmetic Surgery Center. Alright, you guys, we are going to go ahead and hop off. Thank you guys for joining us here. I hope you guys enjoyed. Again, if you'd like to get in contact with our team, I have this form here pinned on the bottom of your screen. You can click on it, fill out your information, reach out to us. We'd love to hear from you. If you're on our YouTube, you guys can visit our website at Dr. Jeneby Plastic Surgery. There should be a number there provided. Just give it a call if you have any questions. And we will see